In healthcare, patient safety, ethical behavior, and professional practice are everyone's responsibility. If something feels unsafe or not right, speaking up is part of protecting the people in your care. Unsafe situations are conditions or actions that could harm a patient, coworker, or visitor. That might be a spill on the floor, broken equipment, a blocked exit, or supplies you need that aren't where they should be. Unsafe situations include improper lifting, infection control concerns, and equipment being used the wrong way. Even before someone gets hurt, those risks need attention right away. Unethical situations are different from physical hazards, but they matter just as much. They can include privacy violations, dismissing a patient's concerns, or making disrespectful comments that damage trust. You might see someone step beyond their role or pressure a patient to agree before they fully understand what's happening. When respect, honesty, or informed consent is missing, it's important to raise that concern. Reporting isn't about getting someone in trouble. It's about protecting safety, trust, and the standards people depend on in a healthcare setting. If you notice a spill in the hallway, act quickly to prevent immediate harm, alert the right person, and make sure the hazard is handled through the proper safety process. Now imagine a patient is being pushed to agree to something without a clear explanation. That should raise concern, especially if the patient seems confused, rushed, or afraid to ask questions. The right response is to respect the patient, avoid giving false reassurance, and involve the appropriate nurse, provider, supervisor, or instructor. You don't have to solve it alone to act professionally. How you report depends on the setting. You may need to tell your instructor, preceptor, charge nurse, supervisor, or use the reporting process your site has in place. Keep your report factual and objective. Include what happened, where and when it happened, who was involved, and the immediate safety concern. Stick to facts, not guesses or rumors. Speaking up can feel uncomfortable, especially when you're new to healthcare or still learning. That feeling is normal, and it doesn't mean you should stay silent. If there's immediate danger, follow emergency procedures right away. And if the concern is outside your role or authority, get help from the appropriate person instead of handling it alone. Reportable situations can include fall risks, privacy concerns, infection control issues, broken equipment, unsafe behavior, and disrespectful treatment. If it puts patients, coworkers, or visitors at risk, it should be reported through the right channel. Take a moment to think about who you would contact for help in your setting. Speaking up protects patients, coworkers, and your professional integrity.